Welcome to the last lecture on preoperative nursing care. During this final lecture, we're going to talk about what needs to be done for finalities prior to taking our patients to the operating room. So during this time, we need to do a chart review. So ensuring all documentation, all preoperative procedures and orders are complete. So with documentation, you need to look to make sure your consent is signed, that you have all of your labs, you have a history and physical, you document allergies, the height and weight, you ensure that your patient has a name band on and that name band matches the chart that you're using. You want to make sure that the area is marked before the procedure begins. You want to ensure that you have a current set of vitals, and with that current set of vitals, that means within 1 to 2 hours of surgery time, and then document any physical or psychosocial observations. Any special needs or concerns, if there's any advanced directives, anything like that needs to be addressed during the preoperative chart review. Also, that all of the signatures are in the proper place, that you've witnessed everything. It might be obvious to you, but to the patient, it's again to ensure their safety and look at those JCO standards, or Joint Commission standards. For your preoperative patient preparation, very typical that almost everything needs to be removed prior to heading back to surgery. So dentures, glasses, contact lenses, hearing aids, artificial nails, piercings, rings, anything like that. Make sure that when you take dentures out that you document on the denture cup whose they are, and then also document in your charting as well. Same thing with hearing aids, glasses, contact lenses, all of those things, rings. If you take something off a patient, you need to make sure that you have it documented who you gave those things to, and that is just to save you from later if those would become lost. They would just come back and say, well, I gave them to Tracy and I don't know what she did with them. If I have it properly documented of where those things went, then we can follow up with who is responsible for the valuables. It's important to tell patients to keep money and things that they really value at home versus bringing them with them into the hospital. If you have a ring that you cannot get off, then it needs to be taped in place, and then you need to document that you've taped that in place. As far as our patient goes, this next slide is just a nice overview of everything that you need to remember. So your pre-op checklist, day of surgery, everything that you could possibly think of, but maybe you can think of a little more. So it goes into client teaching, the consent, NPO. We need to change them into a gown, and for women that means removing their bra, and for women and men typically they will allow them to leave their underwear on, unless of course they're doing the operation in that area. They need to have allergy and ID bands on, fall risk bands as well, so that everyone is fully aware of what is going on with this patient. No jewelry, or else tape them. We do like our patients to avoid immediately going to the surgical suite, just so we know that their bladder is empty. So oftentimes the surgical nurse that comes out to do the pre-op checklist after the floor nurse has done the pre-op checklist will have the patient get up and utilize the restroom at that time. Giving preoperative medications. So you can see in this picture that those side rails are up fully, and that's especially important if we use some hypnotics or sedatives, any kind of a relaxant or opioid, so that the patient doesn't climb onto bed and end up taking a fall. So contact lenses out, same thing, glasses need to be off. Dentures and bridges removed, no nail polish. Typically we tell women not to wear makeup either, because it can give a false sense of color. We definitely want to have a good set of pre-op vital signs. Any pre-op lab work, is it on the chart? And remember, when we discuss preoperative lab work, that patient needs and must have a urine pregnancy if she has a uterus. and she has not gone through menopause. Any abnormal labs, so look at what is abnormal. Is it a white count and they're coming in to have an appendectomy because of acute appendicitis? Well, that's probably okay. Or is it a high white count and they are coming in to have a hip replacement? That's not going to be very good. So make sure that you've documented and taken appropriate measures for any abnormal lab values. Make sure the skin prep is done, so that means the scrub as well as the clipper prep. And then if they have history of medication use, so aspirin or Coumadin or Lovenox, anything that would prolong bleeding time, we need to make sure that we have a PT, PTT, INR, those preoperative labs on the chart, so we know that those are within normal limit. Because remember, if they're on aspirin or any anticoagulants, that therapy needs to be stopped, 3 to 5 days prior to having surgery. So those things are going to be important for us to remember. So in a nutshell, that really sums up everything that we have covered during the preoperative period. There is a pre-surgical checklist on page 261 of your textbook. The following iClicker questions will be addressed in class, but if you would, please have some idea of maybe your answers that you'd like to give, but we will review them in class. So iClicker 1, to ensure safe patient care transition from the perioperative nurse to the intraoperative nurse, optimal handoff communication includes all of the following except. So you have a choice between the four, so pick out what you think is best, jot it down, and jot down with the reason why you think so. And if you have supporting evidence, that would be wonderful. Question number 2, when assessing the laboratory work of a 65-year-old patient who is scheduled for surgery this morning, which laboratory value may result in cancellation of surgery? So here again, look at those values. You need to know what's normal. You need to know normal lab findings so you can apply what you know as normal to figuring out what is abnormal. Question 3, during a preoperative assessment, the nurse asks the patient about allergies. Which allergies cited by the patient would be of greatest concern during a surgical procedure? Something I didn't really talk about that we probably will. Again, if you have any questions, please bring them to class, write them down on a paper, send me an email, and we will take the time to review what's cloudy in class so that everyone has a good understanding. And also make sure that you have your NCLEX examination challenge questions done, and we will work through those in the classroom. And we will also be doing case studies and scenarios to apply this knowledge that you've learned throughout listening to these lectures. Thank you. This is Tracy Hansen, and we will move on to intraoperative nursing care next.